medical treatment and surgical treatment. After having this both and having medicine in time, is, as you told, well controlled seizures. Is there any condition uncontrolled seizures? Means after having all this also.
Yes. There happen to be some severe forms of epilepsy in which multiple medicines, trial of some surgical therapy can still remain uncontrolled. This is because during the first 2 years of life, the abnormal circuits form in the brain, and even if the removal of the abnormal source takes place, still those circuits continue to remain and result in breakthrough seizure. So there are these forms of epilepsy, severe forms of epilepsy. They are not very uncommon, we see them quite often, and the management in those cases again would remain a good balance between breakthrough seizures and side effects of drugs. We often do one procedure known as the vagus nerve stimulation. So stimulation of one particular nerve can result in some control. So we try those drastic steps also in certain rare forms of epilepsy. They are quite uncommon.
When it comes to therapy for children with epilepsy, some children who have regular seizures, almost every day, multiple times a day, we have seen that children don't respond to therapy much. The parents get very anxious that the child will respond to and also to therapy. And it's quite frustrating for the therapist and for the parent because the child is kind of stagnating. And what happens to those children who don't get, whose parents probably stop therapy it's complicated, right? To tell the parent to continue therapy, but they're not able to show them the result. But should we suggest them if they can stop, or what is the course of action that we need to suggest?
Yeah. So, just to put it in a concise way, what steps should be taken by the treating therapist who advises the therapy, who advises medicines, but it doesn't seem to work. So why the therapy is not working depends on many things. One, the disease itself is very severe. The brain itself is so much damaged that there are multiple sources of abnormal electrical activity, and the right therapy is also not working. That is one possibility. Second possibility, the uncontrolled epilepsy is because the choice of medicine that I am using is perhaps not right. Third, the dose that I am using is perhaps suboptimal. Fourth, there are other factors that are perpetuating epilepsy. Other factors like there is some drug compliance aspect from the parents, or lifestyle related factors like sleep deprivation, stress. Those issues are not. Number 5 and important is that the cause of epilepsy is not determined. So a child whose brain is damaged because of severe hypoxic damage, the oxygen has not reached the brain after birth, delayed cry was there, has extensive damage, would not respond. Somebody whose brain has not formed properly, unlikely to respond to therapy. But here the catch, the point is that I should know beforehand which kind of epilepsies are likely to respond well and which are not likely to respond. So whenever a parent of a child with epilepsy comes to me for evaluation, based on the workup and using our prior knowledge and experience, we are able to tell the parent that look, this kind of epilepsy has good prognosis. If you take the medicine, the child may become seizure free. On the other hand, the child has a damaged brain. There are several problems. Therapy might control the epilepsy partially, may not control. We might have to try alternative therapy. So these are the things. We should be able to tell the parents clearly that what kind of epilepsy we are dealing with. We don't talk beating about the bush. We should be clear in our minds what are we treating and what are we treating it with. So, and what are the goals? What is the likely outcome going to be? If we tell and discuss this with parents and make them active partners in the care of the child, usually this situation does not arise. But frequently, at times, the professionals themselves are not aware what kind of epilepsy they are dealing with. And a trial of different therapies is being given randomly without any rational justification. At that times, we frequently see frustrated parents, angry parents also, and sometimes violent parents. So,
I'm talking about not medical.
second question, the second part of the question is, if any form of therapy is not working, do you advise to withhold it completely? That means leave the child untreated. Now, seizures are only one of the external manifestations of what is actually happening in the brain. So, although you might see seizures happening 3 or 4 times daily, what is happening to the electrical environment? Withholding therapy may worsen that and make the child totally vegetative, unable to learn new things, unable to recognize parents, unable to indicate toilet needs. So, it's not about seizures alone. Seizures, learning, behavior, consciousness, alertness. All these issues I would take into consideration before advising or withholding.
I did not mean medical therapy. I meant speech therapy and other learning.
Yeah, as I told you, comorbidities exist with epilepsy. Those comorbidities, if a child with epilepsy has cerebral palsy, then he will have problems with movements, he will have stiffness. So those therapies need to go hand in hand. The medicines are for controlling seizures, but to improve learning, improve behavior, improve the stiffness of limbs at times, those issues need to be addressed individually hand in hand. That has to
I may add one point, reaching treated as miniature adults.
Yeah,
So
that is
reaching
very-
out to a pediatric neurologist first is very important.
So pediatric neurologist and neurologist both are different.
Yes, pediatrics. So I cannot just learn adult medicine and now start treating children. I think Dr. Anil will be able to explain it better.
Unfortunately, the expertise in pediatric neurology happens to be very scarce. By that I mean there are very few pediatric neurology doctors in the country. In fact, there would be less than 20, I can say for sure. Those who are appropriately qualified and trained. There might be several who might claim to and treat pediatric neurology patients, but the actual ones would be perhaps 20 or even less. So it is important that you make sure that you are, as Madam said, you are reaching and seeking advice from the right professional.
Right.
How can you make sure that what
So you have to
qualification?
verify. See, now this is the platform. You have to verify through the Nayi-Disha website. Now you have a talk by Dr. Anil. You know he is an expert. So you take guidance. You verify the qualifications, credentials. Now everything is available for you, and you can just check out. So anybody with a trained in pediatric neurology, a DM. In India, we call it DM pediatric neurology, the degree, doctorate of medicine in pediatric neurology. This is especially for, you were asking, seizures are not controlled, you're frustrated. Then I think this is when you should really reach to this doctor who has this qualification.
See, parents are in a vicious circle, Dr. Shivaranjani. What happens, they go to an ex-doctor, he advises some treatment, and they go to that doctor because of somebody referring them, and they stay there with the doctor for some time. He treats them. He doesn't.
So go by your gut feeling always. That's the best thing.
Yeah, it's very hard.
Go by
to
your
work
gut
with,
feeling.
yeah.
The moment you
That
feel
is where
comfortable,
knowledge
the
empowers.
moment you
Knowledge
first
empowers.
check out the qualification, reach out to your doctor, you feel comfortable, and you feel like, yeah, this is the right person. Just trust him and stick to that doctor. Give the doctor a fair time, to take care of it. I mean, it cannot happen like magic.
This is specifically why we have qualifications and experience also on the platform, and we are trying to have 2-3 levels of verification. One is a field visit whenever it's organizations, whenever it's individuals, we insist that they put in the qualification so that you can differentiate. And the third level again is the parent field, because ultimately it is a parent experience that matters, and then parents can learn from each other by understanding the feedback. And again, as Dr. Chandramani said, you got feeling after meeting. But that is the level of information we can provide, and together probably make an informed
You
decision.
have to have faith in your doctor. Once you decide like, okay, he's qualified to treat my child, then give it a fair chance.
Or increased frequency of seizures. There might be other reasons, as I told you, why epilepsy is not controlled. But these support therapies, may it be speech therapy or occupational therapy, physiotherapy, these are unlikely to cause any worsening of seizure frequency by themselves.